Hello, Dr. Jessica here with Proactive Physical Therapy and Wellness. And today we're going to be talking about the pelvic floor examination. So this is going to include the external as well as the internal portion of that exam. So some of the reasons that you may be having this examination done is you are experiencing pelvic pain. So pain with sex, pain with gynecologic exams, pain with putting a tampon in. You may be experiencing leaking, so urinary incontinence. So you leak when you cough, sneeze, work out, lifting up your kids or grandkids, or you may be leaking going to the bathroom or putting your key in a door. That could be some of the things that could be happening. Also, if you are pregnant, before pregnancy or after pregnancy. So some of the things that we can do is we can help to prepare the tissue to give birth. We can also work on if you're having difficulty with pain, leaking, or you may be experiencing a prolapse. So where the tissue around is a little bit more lax and then causing tissues to fall into that area. And so we'll start from the beginning. So with the entire examination, I would be explaining everything to you, making sure that you're comfortable and that you consent to each portion of the examination. And so it's based on what you feel comfortable with, because I know that this is a very sensitive subject and can be triggering to some people. And you may not expect to be triggered, and so that's why we keep the conversation going throughout the entire examination. So to prepare, what you would do is you're going to be lying on your back, and then you would undress from the waist down. And so like I said, you'd be laying on your back and then your feet would be out, okay? And so with this, this would be the view that I would be looking at. Obviously, you have some skin on there as well. And so with that, I would have a light, and that's just so that I can get a better picture of the tissue and see what's really going on. So to start off with, I would just be looking at what your tissue looks like. So is there any scarring? Do I see any differences in the plumpness of your tissue from side to side? Any redness, irritation that I see, like I said, with the scars as well. And then I would have you do a couple of different contractions. So the first one is going to be, you may have heard it as a Kegel. And so with this, it's going to be, you're going to close the vagina and then lift up. So another way I like to think of it is if you're picking blueberries with your vagina, or think of it's an elevator door. And so you're closing the elevator door and lifting it all the way up. And so that would be one aspect that I would look at. Then I would have you relax and then follow that with bearing down or bulging. So it's going to feel like you're having a bowel movement. And so I'll look at what your structures are doing and how they're contracting, relaxing, and bearing down, and see that overall mobility. Then I would put gloves on and we would begin the external examination. And so with this, just to give you an idea of where we're at. So here, we're going to be on that bone. So right where you have the fatty portion, and then you feel that bone underneath, that's here. And then at the bottom, we have your tailbone or coccyx, and then you have your two sit bones here. So that just helps to get your body situated with what we're talking about. So what I would start with is I would start on the mons pubis. So that's that fatty portion over the bone, and see if there's any tenderness in that area. Then we would go down along the bone here, so your pubic rami, to that sit bone. And I would do that on both sides. And again, letting me know if you feel any tenderness, pain, any discomfort. Then we're gonna look more at the perineal body. And so that's the area between the vagina and the anus. And so here I just see if it was moving right, if there was any scar tissue there that could be tender. And then we would go into palpating the muscles. And so with this, sometimes it's a little bit different when you actually have the person there, because you have those outer lips, the labia majora. And so that's more where this muscle here lies, is on that outer portion. And it's this is the ischiocavernosus. Have that on both sides. Then I would bring my finger just into that to palpate this muscle here, the bulbocavernosus, on both sides. Again, checking to see if you have any tenderness, pain, if the tissue feels a little tighter on one side than the other. And then also looking at the superficial transverse perineal muscle. So that goes from that sit muscle all the way to that perineal body, and check to see if there's any tenderness there. Then lastly, I would be looking at the levator ani. So that's that deeper layer of muscles, and see if there's any tenderness in this region. So after that exam is complete, I would note whether there was any differences from side to side. The other aspect of this exam would be to look at the vestibule. And so that's to see if there's any tenderness. And so I may be using my finger or a Q-tip. And so with that, I would be spreading open the outer lip, so that's labia majora, as well as the inner part, which is the labia minora, and checking to see if there's any tenderness in that region, or pain, sensitivity, any of those feelings. The last portion would be to look at the clitoris. And so there's the skin that's over the clitoris, and make sure that that is able to move properly. And so if it's not moving properly, then that can cause some difficulty in terms of orgasm. And so that is a brief summary of the external palpation. Then I would change gloves and use lubricant. And so with this, it is a digital exam. So I am using one finger during the examination. And again, I'll be explaining everything as we go along. To start off with, we're going to start at that first layer of muscles. So my finger will just be going to that first knuckle. And so here I'm going to check for any tenderness in this region, seeing how you're feeling. And then I will have you do the contract, relax, and bear down, and see just how the muscles are feeling in that region, if I feel one side a little bit more than the other. The next portion is going to be, I'll let you know, I'm going to insert my finger farther. So then I'm going to go to my second knuckle. So at the second knuckle, again, I'm going to check to see if there's any tenderness around that region. Any points that you're like, ooh, that's the pain that I've been experiencing. Then I would have you contract, relax, and bear down. Then I would let you know I'm going to insert my finger completely into your vagina. And so with this, I can do a little bit more of a specific manual muscle testing. So similar to when we test your bicep strength, I would be checking to see, what does the muscles feel like when you contract? Do I feel it closing around my entire finger? Is it only on one side? Does it pull in? And get an idea of your overall strength. Then I would have you do where you contract, do that same contraction, and you're gonna hold it and see what the endurance level of that muscle is. After I get that, then I'm gonna see how many of those contractions you can do. So you're gonna contract and hold for as many seconds as you were able to in the previous test. Once I start to notice that your muscles aren't contracting as well, or they're not able to hold as long, then we would go on to the last portion of the test. And that is how many quick contractions you can do. And so that really gives me a more holistic look at what your muscles are capable of doing. And so then when I'm in that third layer, so that's more in this bowl. So I would be palpating and feeling if there's any tenderness in any of these muscles. And so with that, you can think of it like if you poke on your shoulder and you notice that you find a spot that you're like, ooh, that's really tender. And sometimes you may feel it in different areas and you may feel it go to your head. Same thing can happen with your pelvic floor. So I could touch a point in those muscles and you may be like, oh, I feel that all in my hip. Okay, we know that that's an area that needs some work. And so I will be working along that region and I can feel your pubic bone from here. Make sure that the muscle integrity is good in this region. And then lastly, I can go and depending on my finger length and your pelvic length, I can be able to feel the coccyx as well in that tailbone and just see if there's any tenderness there. Then I would remove my finger and we would do the prolapse assessment. So with this, I would insert my finger to the second knuckle at the level of your hymen. And so there, I would be looking at the laxity of the tissue. So if I push my finger down, so I would be looking at if any of the structures above were gonna begin to bulge out. So I would have you bear down a couple of times and see how far that tissue goes in relativity to my finger and the hymen. Then I would flip my finger up and then we would be looking at the posterior structures. So what's in the back, the rectum, and looking at if any of those structures are starting to roll out with that bearing down motion. And so overall, this is a brief overview of what can be included in an internal and external exam for the pelvic floor. Now, everybody is different, like I said previously, and so it may be different based on your comfort level and tolerance. And this is going to be a conversation throughout the session of making sure that you're okay and that you're comfortable with continuing with the exam. And we can have that conversation throughout our appointment. And then if you have any questions, please feel free to contact us at Proactive Physical Therapy and Wellness. Thank you and have a great day.